Hi, my name is Dr. Mansoor and I am from Pakistan. I am participating in Dr. Randy Need's video challenge. As a prerequisite for the video, I'm gonna throw this ball downstairs and go to my study table and have a chat with you regarding some biostat topics. So stay tuned and thank you for the listening. Hi guys, today we are going to learn about sensitivity, specificity, positive and negative predictive value with the help of this question. So let's jump in. A new test is used to diagnose UTI in women. Is being assessed. The comparison gold standard is positive urine dipstick and urine culture. Results are given below and the results are in 2x2 table format. So first let's understand how to draw a 2x2 table, and from there how to drive the equation for all these four things. So in order to draw a 2x2 table, there is a pre-made 2x2 table by me. So I have written tests on this side and disease on the top side. You can write it alternatively. I have done with a conventional manner. So there are two possibilities that either test will be positive or negative. There are two possibilities that disease will be positive in patient or negative in patient. So we label this table according to the test. So if test is positive, we write positive. In test is positive in all this row. So we write positive, positive. Now if test is positive and disease is positive in the testing population, then this is called the truly positive test. Means disease is positive and the test is positive. If test is positive but there is no disease, that means this is a falsely positive test. Now we label the row according to the test. If the test is negative, this is negative. This will be also negative. If test is negative and the disease is negative, this is truly negative result. If test is negative but disease is positive, this is falsely negative result. So this is how you construct a 2x2 table. Now in order to understand how to drive for the sensitivity, specificity, positive predictive value and negative predictive value, I'm going to give you a visual clue. If you remember this visual clue, you will never ever do this equations wrong. So in order to calculate for the sensitivity, you will go from here to down there and write truths on the top. Truths will always be on the top, no matter it is sensitivity, specificity, positive predictive value or negative predictive value. Truths will always be on the top. So the sensitivity is true positive upon true positive plus all other things, true positive plus false negative, and the specificity would be true negative and false positive. You will go from here to there. So specificity will be truths on the top. Truths will always remain on the top. True negative plus false positives. Now in order to calculate the positive predictive value, you will go from here to here. In the calculation for positive predictive value, everything will be positive. No, either true positive or false positive. Truths will always be on the top, and upon true positive plus false positive. Now this is the direction for this is the positive direction, and this one is the negative direction. So you are going to positive direction for positive calculation of a positive predictive value, and for negative predictive value, you will go from here to here, and truths will be on the top, true negative plus all negatives, true negative plus false negative. Now this is how you drive the equations. You can learn it by looking at this visual clue. For sensitivity, you will go down. For specificity, you will go up. For positive predictive value, you will go right. For negative predictive value, you will go left. Now let's put in the numbers and solve for all these sensitivity specificity based on these numbers. Now let's put some numbers and calculate for sensitivity, specificity and positive and negative predictive value. So I have a pre-made 2x2 table, and let's put in true positive and negative so that we can solve this. So if test is positive, this all row is positive. If test is negative, this all row is negative. Test is positive, disease is positive, this is true positive. If test is negative and disease is positive, this is falsely negative. For the calculation of sensitivity, we only need, as we have learned, we only need these two things. We only need this column. So true positives and false negative. What are the true positives? 400 are true positives. And what are the true positive plus false negative? 400 plus 100. This will be 400 upon 500. Now have a simple math. 4 by 5 equal to 80%. So the sensitivity of this test is 80%. Now in order to calculate specificity, as we have learned, we will go from here to up. And this is true negative, negative and negative is true negative, positive and negative is false positive. So we will calculate it like 450 upon 450 plus true negative and false positive. 450 plus 50. So specificity will be equal to 450 upon 500. And 450 upon 500, 45 upon 50 equal to 0.9 or 90%. Specificity will be 90%. So let's move on to positive and negative predictive value. I have already made the same thing for positive and negative predictive value. As we have learned, for positive predictive value, we will move from this side to this side. These are the true positives. These are the false positives. So 400 upon 400 plus 50 equal 400 upon 450. 0, do the simple math. 40 by 45 equal to 0.88, or positive predictive value equal to 88%. Now let's move on and calculate the negative predictive value. I have already written the equation that we have derived on the first page. For the negative predictive value, we go in the negative direction. These are the true negatives and these are the false negatives. So true negatives are always on the top. So 450 is on the top and 450 true negative plus false negative plus 100 is on the bottom. So 450 divided by 550, 45 divided by 55 equal to 0.81, or negative predictive value equal to 81%. So this is all about the driving the equation of sensitivity, specificity, positive predictive value and negative predictive value. And we have learned how to draw the 2 by 2 table and how to draw all the equations from the 2 by 2 table and solve any question regarding these 4 concepts. So thank you for staying with me.